Okay. So the question at hand is, can we measure flourishing in religious communities? And I think that's a good question to ask and a fair question to ask. Let me tell you what I hope to cover today in our conversation. I wanted to begin just by giving a background on what the Human Flourishing Program is, what we aspire to do. I then want to talk a bit about how we measure flourishing, how we define it, how we're trying to measure it, and some of our new work trying to do that at a global level. I then want to take a few moments to talk about some of our other research that's focused more explicitly on religion and spirituality, and then come to the question of both the limits and the possibilities of empirical measurement, and end by highlighting some new work that we are trying to do within religious communities, and then open it up for questions along the way. So let me begin by just providing some background about our program at Harvard. So we were at idea stage in 2016. In 2017, 2018, there started to become more momentum and a beginning staff. This was led by my boss, Tyler Vanderweel. I joined in late 2018. I think I was the sixth person on the team, and we were a fairly small shop, but we've had quite a bit of growth over the last several years, particularly because of the work we've done empirically. We're actually housed within Harvard's Institute for Quantitative Social Science, which is a bit of a mouthful. But the aim of our program, very lightly put, is to both study and promote human flourishing. But how we do that is trying to bring people from different disciplinary backgrounds to have deep engagement together about what it means to flourish, the limits of flourishing, the confounders of flourishing. And then part two is to develop systematic approaches for how we share that synthesis of knowledge across disciplines. If you've ever done interdisciplinary work, you know that in of itself can be both very invigorating and sometimes challenging. But when it comes to writing together or sharing content together, that's where the rules of the guild really start to apply. So it's been a fun exercise to figure out, how does a theologian join an empirical paper? Or just how does someone with empirical training engage with more philosophical or theological content? And we are working that out slowly over the years together. And it's really enhanced by academic friendship. Intellectual friendship helps an enormous amount in how we pursue these things. But those are the aspirations of our program. So our core staff include those who are trained in philosophy, theology, psychology, public health, epidemiology, sociology, history, education. Many people at Harvard have numerous degrees, more than they need. So there's other degrees floating in the background for people. Mine is music, that sometimes does or does not make an appearance in our conversation. But that's kind of the core training that we bring to the table. And what do we spend our time doing at the Human Flourishing Program? Well, the main thing that we've been spending our time doing is working on empirical research, primarily using what we call secondary data that other people collect, these large panel studies that are really hard to run. We get to analyze that data once it's already been collected and is ready for use. We are also undertaking new efforts where we've been part of generating that data ourselves. I'll come to that in just a moment. We also do a fair amount of work on something we call item development, which is actually thinking about what is a survey and what words do we put in a survey and how do we define certain ideas, and then create items that index to those definitions. If you see a research headline, you might see something like, hope prevails. But when you read the paper that someone has built that study on, it's actually optimism, for example, that they're writing about. So getting really into the weeds of what are we talking about, how are we defining it, and what are the current measures, and can we build on the current measurement and maybe deepen in some ways or complicate in some ways how we approach measurement of different aspects of the human experience. We also undertake a fair amount of education, both teaching classes at Harvard and then offering public forums where we can share with both our academic colleagues and the general public. And then a new part of what we are trying to undertake is promotion efforts. If you remember back to the beginning, we both want to study and promote flourishing. We've spent a lot of time on the study part, and we are now trying to grow new muscle. And how do we promote these types of things? Many people have said to us over the years, we love your research, it's great, So what? What do you do? How do you, what's your policy prescription? What's your program that you would recommend? And oftentimes we're like, what would you recommend based on what you just heard us say? So we are ourselves trying to grow in this area and think more carefully alongside policymakers, people who are working in communities, to say, how do you act on the research? How would you promote these ideas in the real world? Speaking of definitions, I thought I would share ours with you. Our definition of flourishing is the relative attainment of a state in which all aspects of a person's life are good, including the context in which that person lives. If that feels quite broad, it is broad on purpose. There are many contested visions of flourishing, and rightly so. This is the one we feel leaves enough space for the research to take root, and also is accurate for what most people would aim towards with their life, that they want all aspects of their life to be good, not just their own life, but the places that they live. When our framework first was put forward by Tyler Vanderwill in 2017, this was the schematic that was drawn from kind of the seminal paper on this topic, where he outlined at the time 5 domains of flourishing that were universally shared. People universally want to have happiness and be satisfied in their life. They likely want to be physically and mentally healthy. They want their lives to have a sense of meaning. They think that character matters, who we are and how we treat one another matters, and close social relationships matter. He would say then, and we would say now, that this is kind of a minimum common set. This is not meant to be exhaustive. You'll notice on this list that there's not any spiritual or religious factors in an explicit sense in the domains of flourishing. There is in what we would call the pathways to flourishing. We know that a lot of research, which I'll get to in a minute, shows that when people are engaged in the spiritual life, they tend to see better outcomes over time. So we know that that can promote flourishing. But when we're thinking about how we measure flourishing, we began with these 5 domains. And then over time, we added a 6th domain, which is material and financial stability, that's just a critical building block for people, that they are able to have the basic needs, their basic material needs met. A lot of times in research, people can be a bit secretive about how they're really conceptualizing things, or even what survey items they're using. In our work, we try to be as open and free-handed as possible. So here are the items we use to measure flourishing. There are all 12. They're available online, and I would encourage you to read them and see how they resonate with you. I think that they can cause different reactions in people. Some people think, oh, this is so light. How could this measure flourishing? And other people think this is a bit invasive. How could you ask me about my happiness, or whether I can delay my gratification? So read it, see what you think. We've been able to use this measure now fairly widely. It has been psychometrically validated and has given us a sense of confidence that even if it's not measuring flourishing in its full comprehensive state in every person's life, it is getting at something real, and is certainly far more expansive than many of the other ways that we think about well-being or just happiness. This is trying to hold some of these ideas together and say we have to look at a broader picture of a person's life if we're going to begin to talk about what it means to flourish. If you're interested in this research or in other things that I mentioned today, our program's website, which I hear is going to be upgraded sometime soon. So hopefully this looks, it'll still have a research tab in its new form, but the tab that I circled here is where you can see all of our research. You can also sign up for a monthly blast that we send out, just trying to highlight some of the new empirical work, but also share some of the conceptual work that we're doing behind the scenes on the different topics that we cover. So I just share this with you if this is an area of interest. I wanted to briefly touch on a new project that will be officially released later this month on April 30th. It's called the Global Flourishing Study. And this is a massive undertaking, done not just by us, but by many other partners. Our chief academic partner is Baylor University, and our PI there, Byron Johnson. Our PI at Harvard is Tyler Vanderweel. And then we've also do this work in partnership with Gallup and the Center for Open Science. What is the Global Flourishing Study? The Global Flourishing Study is following over 200,000 people in 22 countries over a 5-year period. Trying to understand the flourishing. We use the 12 items I just showed you there, but a range of other factors that have to do with people's health and well-being, both the positive aspects of that in their life and also the more negative aspects of life. Questions about loneliness, anxiety, depression, suffering, also questions about hope, forgiveness, the various types of connection they may or may not have in their communities, their sense of political voice. And why follow people over time? Because when you follow the same person over time, you learn something that is more specific than asking the same question generally to different people at different time intervals. The first thing I said is called longitudinal research, and longitudinal research allows you to get closer to causal claims in the data. Whereas cross-sectional research, asking the same question to different people over time, makes it much more difficult to attribute causality. Many people say, oh, we should do more longitudinal work and we should do longitudinal work across, cultural contexts. This would be so great. And why didn't they do it? Because it is incredibly expensive to do these kinds of things and complicated and hard. And we have learned that firsthand over the past few years trying to undertake this project. We have 40 people from the different universities I mentioned, as well as affiliate universities involved in helping just analyze the data that comes in. We also have made the data openly available so that other researchers around the world can access it, learn from it, use it. All of that is facilitated by the Center for Open Science because we believe that transparency is going to help all of us understand what decisions did we make in our analytical plans, how are we drawing our conclusions, and how does wave one, for example, which really is still cross-sectional, it's just one sample, how does that get strengthened over time as we add subsequent waves of data and we can ask questions with more focus about what causes what in people's lives over time. We also have a set of questions in the study that look at childhood factors. So we're able to look, for example, at the experience of childhood trauma and how that might affect people in their adult life. I'm being a little bit vague on purpose because we're not actually allowed to talk too specifically about the results of the study until after April 30th. So there will be several launch publications that are released on that day that summarize wave one and also highlight where we hope to go, the questions, the types of questions we hope to answer in wave two. So let's do this. So another aspect, now I can't see you anymore, so hopefully you stay with me. Okay. So another aspect of work that we do at the program is research on religion and spirituality explicitly, but also fairly broadly defined. A few of us at the program are part of a program at Harvard called the Initiative on Health, Spirituality, and Religion that is housed largely at the School of Public Health and the medical school. And it involves core faculty members that come from a variety of perspectives, not just in their academic disciplines, but also in their own kind of spiritual or religious commitments, which makes the work quite fun to do because we're having to, amongst ourselves, say, how do we pursue common research and kind of shared empirical understandings of the role of religion and spirituality in people's lives. I want to highlight two publications that we've put forward in the last few years that really were aimed at the broader public health and medical community in the US, not specifically to church audiences or Christian audiences or religious audiences, but I think the findings of these work are highly relevant to religious communities. So the first study was published in JAMA, which is a leading the Journal of the American Medical Association. It's one of the top medical journals in the US and really has a high bar for the kind of research that they would consider publishing. And so this was what we call a systematic review on the best empirical literature on the relationship between spirituality, serious illness, and population health. And this was a massive undertaking. If any of you ever are invited to be a part of a systematic review, you should say no thank you, because it is quite a lot. I was asked to be a part of this when I was pregnant with my second child, and was told it could be just a couple months. And I was in late pregnancy, and I thought, well, it sounds like a lot of reading. I can sit in a lazy boy and read. That sounds like an excellent end to this pregnancy. And it wasn't until my third child was born and in my arms that this was published. So it was much longer than a few months. So what was this? Well, what we did is we looked at all of the empirical literature that we could find that was published between the year 2000 and ended up being the year 2022. And we had what we call an inclusion criteria. We wanted to closely examine the studies that met a very high bar of rigor, which meant that we had to exclude a lot of wonderful work because the sample size wasn't large enough or the study design had some weaknesses to it. But we wanted to look at gold standard research to understand what the empirical literature was saying to date about religion, spirituality, and health. So that meant that we read the abstracts of over 15,000 articles twice to make sure that we weren't missing anything that was good. And then once we boiled that down to a little over 500 articles between the two categories of serious illness and population health, we then had to study those articles very, very closely as a team. And then we also invited an external panel of over 20 experts from different fields to likewise review the empirical work and work together to say, what do we see that can be commonly claimed about the empirical research to date on the role of spirituality and health. I will not belabor this. I'll send this in the slides, but there were 8 core findings that the committee deemed were supported by empirical evidence. For example, things like religion and spirituality are important for most patients with serious illness. That may seem like a very weak or low bar claim to those who work in spiritual communities, but in non-religious spaces and secular spaces, saying something with that kind of strength and clarity is rare and really only can come on the strength of the empirical evidence. So there's a number of statements made about serious illness, an equal number of statements made about population health. The strength of the evidence in population health really has to do with how we say it would be religious community participation or service attendance, where you do see this strong effect of people attending services more frequently and having better outcomes on a range of dimensions for well-being and psychological health. I'll stop here because I imagine in a room full of clergy, you know firsthand that that's not always the case. I am also a pastor's daughter. I probably should have owned that up front. And I know firsthand that going to church is not always pleasant and doesn't always yield happy fuzzies at the end of in a particular service or even a season of services. And so what's really interesting about this research is it looks, again, that longitudinal idea at a population level. So these are averages. This does not mean that there are not uncommonly negative or even hyper positive experiences. When you hold all of that as an average over time, you see these positive effects in people's lives, not in every dimension, but in a number of dimensions. And that's really striking, particularly to people who aren't religious, because that's not what you would expect to see. And even people who are religious, it can be a bit surprising where you think, well, I guess what we're doing isn't half bad. So this research can hit people's ears quite differently depending on where you're coming from. The end of this paper listed a series of recommendations. Okay, if all this is true, here's what we think we should do. And then the paper ends. And that's kind of the end of that JAMA systematic review. And that was as far as any of us wanted to go with it at the time, especially the lead authors on that. And so this last year, we have this phrase voluntold. Do you use this in the UK?
No.
No. You're volunteered, but you're also told to do it. So it's voluntold. So I was voluntold to lead this paper for a special issue. We weren't sure it would be accepted, actually. It was Health Affairs is, again, one of our leading health policy journals in the United States, not at all religious in its orientation, but they had a special issue on the future of public health, like where do we go from here post-COVID, and maybe a point of self-reflection. And so I led our team to pitch the idea that we should consider spirituality as a determinant of health. And I was a bit shocked that it was accepted for consideration. So we still had to write the paper. They could still reject it. But what we did is we took that JAMA systematic review and we took those recommendations at the end. And then we went and wanted to introduce our friends and colleagues across the US to good exemplars, examples of people at local, state, or national levels who were operating in pluralistic societies. How do you actually scale these things? We do not need to make these kinds of programs and policies up from scratch. There's great places to look. And so really that's the thrust of this paper. In interest of time, I'm going to go a bit quickly through this content. You can read the paper, look at the slides later yourself, but we took that table 5 from the JAMA study, and which had 6 things, and we boiled it down further to 4, the kind of the essence of the recommendations. These are, again, I think for a room full of clergy, this will feel like a pretty low bar, but just keep in mind our audience that the first thing is just recognizing spirituality as a social factor in health. The second is the use of evidence-based approaches in spirituality and health. One of the chief concerns, rightly so, of secular colleagues or people who just don't think religion has a place in health at all is that this can feel like it will go off the rails very, very quickly. And so what are the evidence-based uses of spirituality? They're applied in clinical settings or in community settings. There's some great examples that we were able to point to. The third is just the need to provide spiritual care education for health professionals. This is not proselytizing. It is as simple as saying in a single lecture that these are just realities and factors in the lives of people we serve and care for, and just letting that be a category of how we think about the human experience. Full stop. There's also great opportunities for those who have interest to do training courses for how do you care for patients in this aspect of their life? What's the appropriate role of a clinician versus a chaplain? These kinds of things. And then the last is to provide spiritual care and support within health systems. And there again, we really highlighted the role of chaplaincy. So in each of those 4 buckets, we were showing our predominantly US audience how these things have been done and done well and done thoughtfully, and that if this is an area for policymakers of interest, they could learn from these examples and potentially scale. That's to our more secular public health colleagues, but there's also been work that we've written up for more religious audiences. Particularly, this is one that was published in Christianity Today a few years ago, bringing that same research about religious service attendance, but communicating it to the clergy and saying, here's what the research shows, what happens when people participate in religious services more frequently, and written as a take heart, because our pews, as I imagine is the case in the UK, seem to be emptying in a lot of places. And so there's reason to take that seriously, to have concern, but also to show the clergy themselves what happens when people participate in religious community. Maybe this can help be a bit of wind beneath the sails in this time. With all of this work, I think it's a very fair question to ask if we can get even closer to with measurement to particular religious concepts or practices or ideas. Religious and spiritual measures that are already at use in the empirical literature can irritate people in a number of ways. Often people are irritated because it sounds so broad. It doesn't even sound anything like me. It just, could you be more specific? And then other people are irritated that even in the broad language, they're still reading Christianity in a lot of the kind of the valence or in the emphasis of different items. And so there can be a real point of upset for how we would go about measuring spiritual or religious factors. And we think there's a fair case to be made that at some level, when you're wanting to get closer to particular religious communities, you do actually have to take the ideas of that community more seriously and develop conceptual definitions and items that will resonate well within that tradition and may or may not resonate at all with different religious traditions. And so that's a very different opportunity than population health measurement, where you actually are trying, like our 12 items, to come up with wording and concepts that are universally applied. Some of that does break down when you're trying to apply it to a local congregation or to a local religious community context. So we think of it as a both and, that there is a role for universal measurement, and there's also a role for particular conceptual development that indexes to particular views and visions of the world within a religious frame. We would say that is it possible to measure the holy in some sense? We would say no, it's probably not possible to perfectly measure such things, but we can still try. And we see every day people trying to measure things that seem unmeasurable and doing so with different construct definitions. And so our posture has been, let's contribute to that conversation. I don't think we'll get there perfectly, but we can improve the way we measure things. I want to give you just a few examples of how we've done this to date, and how we're trying to kind of ever deepen. So our program has done quite a bit of work on forgiveness. Forgiveness is both a universal concept. A lot of different traditions and cultures embrace the idea of forgiveness, and then it has particular resonance as well within Christian communities. So there's some items that exist in these big studies on forgiveness. Our program, I was not a part of this, our program helped lead a large randomized control study on forgiveness and trying to understand if people went through a workbook that would help them cultivate more forgiveness in their life, what would happen over time. This study showed that it decreased anxiety and depression. So we're taking this big idea of forgiveness, which has centuries of thought, but trying to operationalize it in a new way in the 21st century and study it under kind of a different set of conditions and see how it works. A few studies that I helped lead used data from a big study in the US called the Nurses' Health Study. And there was a single item in there asking people how frequently they forgave others, how frequently they received forgiveness from God. So it was a tripartite item, and then how frequently they forgave themselves. And so we were able to look over a 3 to 7 year period to say, okay, for those who forgave the most frequently, what kinds of outcomes did they see in their health and well-being? We saw things like improved positive affect, increased social integration, decreased depression and anxiety, decreased hopelessness and loneliness. Very interesting things with even just a single item that we could see in people's lives. Hope is another topic I've spent quite a bit of time thinking about and working on over the years. I led 2 studies on this topic, again, single items in existing large cohort studies, one among older adults, one among adolescents, that just simply asked people about their level of hopefulness in life. And we saw there again that people who had higher levels of hope over time in older adults saw reduced chronic conditions, more frequent physical activity, improved psychological well-being, and reduced distress and loneliness. In adolescence, we saw for young people who in adolescence said that they had high levels of hope, by the time they reached early adulthood, they had higher levels of cognition, self-rated health, less physical inactivity, and then a whole host of other things, fewer depressive symptoms, less perceived stress, greater happiness, even more satisfaction with parenting, and increased voter and volunteer participation. So this thing we're calling hope that we're measuring, even when lightly assessed, we're seeing some really interesting outcomes over time. But in each of these papers and in all of this work, one of our criticisms of our own study has been that the measure itself might not be sufficient to cover the whole concept of what hope or something like forgiveness is really doing in someone's life. And so a project that is still currently underway has been a 5-year effort to disentangle hope and optimism, which are often really conflated in the literature. I mentioned that case earlier of someone who does a study on hope, but you actually read, and it's like, I've reviewed studies like this where it's like, well, you actually only asked about optimism, not hope. It's a little bit of a Venn diagram to be sure, but there's also distinction in these things. So we've put forward both what we hope is a richer conception of hope that is generally available to people. But then we understand that within the Christian tradition, there is a form of theological hope that has greater distinction still. And could we possibly try to develop a measure that would get at theological hope, for example? So this is a bit of work. I'm just kind of running through some highlights where Tyler and I, a few years back, took the theological virtues as a case study, so faith, hope, and love, to see what the research was currently saying about those 3 constructs and where measurement might go within the Christian theological tradition, how we might deepen the way that we think about hope, faith, and love. In a different project, we looked at this concept of well-being, but then this idea of well-being having nuance at the level of particular religious traditions. And because of our own orientation, Christianity was the most appropriate place for us to say, well, what would a Christian concept of spiritual well-being look like? We came up with a number of domains and 30 items for that measure. We have since realized that no one has what we would call in survey language the real estate for 30 extra questions. Like, people's attention spans aren't that long. So we are currently working to reduce the number and test that to see if we can get down to a more concise set that might be more useful in practical situations, but that maybe have more orientation towards a Christian understanding of faith, hope, and love, for example, that might sit beneath our general measure of flourishing, for example, and help maybe further unpack how within a Christian context people are understanding the nature of suffering, the love of one's enemy, the love of one's neighbor, the love of God, and to kind of situate or I think further complicate the picture of what it means to flourish in the present life. I wanted to also just commend this book to you that was released this year, written by Tyler, which is his take on a theology of health. I think it's very, very thoughtful and well written. So I commend that to you if this is an area of interest. It's not every day you have an epidemiologist writing a theological treaty, but here you go. So if that sounds of interest to you, please do look it up. I think a very natural, and this will be my last set of comments, a very natural endpoint to some of these efforts around measurement is to say, well, if we know that religious community participation really matters, and we know that there's a role at least for tradition-specific measurement alongside universal measurement, how does that really play out in the world? And this also moves into that promotion piece. How do we actually help religious communities themselves operationalize these ideas? This can all sound a bit lofty and a bit abstract. If we had to boil it down and help everyday congregations and communities do this measurement, what would that look like? And so this is new work that I'm leading at our program that we're just simply calling Flourishing in the Church. And again, like most things, we're doing it in partnership with other institutions and church networks here in the US, just at a very early level to say, how would we help churches do this work meaningfully? And how do we analyze the results in a way that is substantive from a research perspective, but not removed from the everyday concerns of pastors and clergy and ministers, that will actually attend to the kinds of questions that they care about and help them and support them in their ministry efforts. So in that work, we have really three marching orders in our early years. The first is just to synthesize current knowledge. There's some irony to the fact that here we are at the Human Flourishing, and we're a bit late to the party when it comes to thinking about flourishing in the church. There are many who've gone before us, in fact, that we have much to learn from, both in the US and around the world. And so we've been doing a lot of just close reading and getting to know others who are asking these questions, learning from how they're thinking about these questions and how they're doing survey work in churches directly. We think that we can contribute to the conversation with some forms of conceptual clarity. We have been working on measurement of the theological virtues for several years and are beginning to bring those more into the public domain. We think that that might be a way to contribute to how we do measurement in Christian contexts. And then there's always opportunities for new streams of research, either helping more rigorously analyze existing data or also using new opportunities for data collection. The last thing that I'll just comment on briefly when we're thinking about flourishing in the church is that it became pretty clear as we were learning from our peers and learning from others that people are talking about this and working on it in pretty distinct ways. And it seemed to us that there were three very broad buckets that people fell into when they were working under the broad heading of flourishing in the church. The first was to really think about flourishing individual Christians. How are individuals of faith doing on a number of dimensions? And actually, a lot of our work on religion and spirituality is taking a lot of individual level items, individual level appraisals, and then looking at it at the population level. Okay, so that's a category. The second category, and sociology contributes a huge amount here, is how are congregations as a social unit doing? And there's a lot of particular questions that are asked only when you are talking about an appraisal of a congregation as a whole. And so that's a really important body of research to learn from and to think about. And then, and here's my bias, because I'm in public health, I have thought a lot about and interacted in scholarship with the role of faith-based communities or congregations who are contributing in outward social expressions in the community. And so there is effort to try to understand, what are these congregations doing and what is their social impact, and are they making a difference, and what's their footprint? There's some that are trying to quantify like the economic output of congregations. But that often sits in a very different lane and stays quite distinct from those first two buckets. What we hope to do in our research is to hold those three together more closely, which is really complicated to do because, again, people's attention spans, how many questions can you really ask of people? But we think that all three matter enormously and are not necessarily linearly related. So is it that people who have strong personal faith and are part of healthy congregations only then serve? Or is there something about Christian action in the world that actually somehow fosters deeper faith and maybe contributes to healthier or less healthy, in some cases, congregations? And how do we look at these things from that multidimensional perspective and do justice to the research that exists, to what's possible to use with the empirical method, but as I say as well, be very attentive to the kinds of questions and concerns of the clergy in the context where we're working. So this is what we're currently doing this year. We're just working with 12 congregations in 2 different geographic areas to see if we can make some headway on this and do some learning that might then be of use to others along the way. So I believe that's my last slide, and you have just a few minutes until dinner. So happy to chat or send you off, whatever seems best.